Let's look at the San Jiao Meridian and its 23 acupuncture points. Today I'm going to discuss the San Jiao organ's function according to Chinese medicine, because that can be really confusing at times. And then I'm going to look at the meridian pathway, the function, location of each point, and I'm going to add up my clinical pearls. Welcome back to my channel. If it's your first time here, I'm Clara from AcuPro Academy, and I create Chinese medicine and acupuncture contents for students and practitioners, making it easy to grasp and fun to learn. Let's go. Let's face it, the San Jiao is a little bit of a weird entity within the Zang organ theory in Chinese medicine. First of all, nobody can agree on how to translate the San Jiao. So many books will have triple warmer, triple heater, burner, energizer. That is so confusing to me that I prefer to keep it the San Jiao and keep it the Chinese name, because that way we're not confused about so many translations. And because in the Zang Fu theory, the San Jiao is the only one that doesn't connect to a physical specific organ like the liver or the heart or the lung or the large intestine. This is why I'd rather keep it the San Jiao instead of translating it. Does that make sense? Okay, so let's try to demystify this weird entity organ system / meridian in Chinese medicine. First, the San Jiao is divided into 3 parts: the upper jiao, the middle jiao, and the lower jiao. The upper jiao contains the lung, the heart, and the pericardium, which is in the chest area, which makes sense. The upper jiao connects to zong qi, or gathering qi, which allow us to breathe and expand our chest area. The middle jiao contains the spleen, the stomach, the gallbladder. I'm going to talk about the liver in a little bit, but right now let's think of those 3 organs, and the middle jiao connects to the yin qi, or nutritive qi, which is in charge of digesting food. So it's also in charge of zhong qi, which is the middle qi, for better digestion. The lower jiao contains the kidney and the bladder, the small intestine, the large intestine, and the liver. Now let's talk about how the liver can be in the middle jiao or in the lower jiao, depending on the text you're reading, because TCM is never black or white. It is always 50 shades of TCM. Oh, I had to go there, sorry. So when it comes to the liver, sometimes it's going to be put in the middle jiao. And when you look at the tongue, the liver is kind of like on the side. So it doesn't have a front, a middle, or a back, because it does the whole side. However, on the tongue, we could see the front of the tongue is lung and heart. So that's the upper jiao. The middle of the tongue is spleen and stomach, middle jiao. And the root of the tongue, or the back of the tongue, is the kidney, bladder, small intestine, and large intestine. The liver will be put in the middle jiao as an organ. But as a meridian, it's often going to be in the lower jiao, because the collateral of the liver goes and wraps around the external genitalia. So if we have anything happening in the lower jiao, including external genitalia outbreak or a bladder infection after intercourse, this is going to be a liver collateral or lower collateral issue, which now is affecting the lower jiao. See how that works? So I like to use the meridian as a lower jiao, but the organ as a middle jiao. You're going to have to decide what works best for you. I just wanted to give you that sidebar about the liver. Nobody agrees where it should be when it comes to San Jiao. The lower jiao connects to yuan qi, or source qi, which makes sense because the kidney is the root of who we are. It's also in charge of fluid transformation. I see the San Jiao a little bit connecting to the lymphatic system of our bodies, because it's in charge of detoxifying and getting rid of damp and heat specifically. So if we have damp and heat in the upper jiao, it will affect the lung and heart. For example, if we have a cold or a flu where we're coughing a lot of phlegm, that is damp. That is also going to be yellow. That is heat, for example. In the middle jiao, we could have heat in the stomach and dampness in the spleen. So dampness in the spleen would have bloating, craving for sweet food, fatigue, and loose stools. And heat in the stomach would have acid reflux, bleeding gums, bad breath. So you could see how this damp heat can affect the middle jiao. In the lower jiao, we can have a bladder infection. We can have, like I said, external genital nasal outbreak, blisters that are really painful, that is damp and heat. Make sense? So look at damp and heat affecting the San Jiao. How do we apply this in clinical practice? Well, let's say you have a patient that have dampness in the spleen and heat in the stomach, which are quite opposite, right? Heat dries fluid and dampness is excess fluid. So what we want to do is we want to do points that are going to relieve the excess heat, like large intestine 11. And if it's affecting the stomach, probably REN 12, maybe pericardium 6, maybe REN 17, right? We want to really address the heat in the stomach. Now, we also want to get rid of the dampness in the spleen, like spleen 9 would be great, and add spleen 3, maybe spleen 6 to allow better flow of the water in the middle jiao. And then we want to add up San Jiao points that solidify that middle jiao issue. Does that make sense? So we're going to look at all those points and see how we utilize them in clinical practice. But this is how we use the San Jiao as a meridian much more than as an organ in the Zang Fu theory. So let's look at the San Jiao meridian. It is a hand meridian because it starts at the hand. Anything that starts or finishes at the hands are hand meridian. And it is a yang meridian. So this is a Shao Yang meridian. The opposite is a foot Shao Yang, which is a gallbladder. Shao Yang means lesser yang because it doesn't have as much yang as, for example, the yang main meridian, which are the large intestine and the stomach. It is really activated or peaking between 9 p.m. and 11 p.m. Because it's in charge of all our organs, right? Upper, middle, and lower jiao. Think of this as 9 to 11 p.m., the time to put all our organs to sleep. So in summer, we can go all the way up to 11, and in winter, we go with the seasons, we go closer to 9:30, right? We want to really be sleeping between 9 and 11 p.m. The organ before that is the pericardium from 7 to 9 p.m., which is its counterpart, yin and yang, right? And the pericardium is in charge of protecting the heart. So from 7 to 9 p.m., this is when we get ready for bed. We calm down, maybe we do some stretching exercise, we read something good for the soul, we are calming our mind. It's not time to watch some gory movie on Netflix, right? So we prepare for bed, and then at the San Jiao time, we go to bed and we go to sleep. Yes? Okay, now let's look at the pathway of the meridian. The previous meridian in the cyclical flow of qi was the pericardium. So the pericardium finishes at the middle finger, and so it is going to connect to the San Jiao. The San Jiao starts at the fourth finger, as you can see in my beautiful drawing, which I know most people laugh when they see this. My husband was laughing this morning, literally on the floor. He's like, this is the worst thing I've ever seen. But it makes my point, right? Doesn't matter that I'm not a good drawing person. So we start with San Jiao 1 at the fourth finger tip. And we're going to ascend along the dorsum or the back of the hand between the fourth and fifth metacarpal. And we're going to go through the wrist, again, all on the posterior back of the hand and the wrist, all the way up to the elbow. And we're going to go right through the back of the elbow, the posterior part, and along the triceps, all the way to the shoulders, specifically the back of the shoulder, the posterior deltoid, going through the trapezius right here at San Jiao 15. And then from there, the meridian's going to go into the front and enter the body at the supraclavicular fossa, or stomach 12 is located. It will go into the body and connects to the pericardium, its related organ. Then it will go down to the middle jiao and the lower jiao. So it connects with all three jiaos. There is a branch starting from the upper jiao, and it's going to come out at the supraclavicular fossa and emerge to go along the neck where it connects to San Jiao 16, going to the back of the ear, go around the ear, and will go up to the top of the corner of the head where stomach 8 is located. Go back down along the cheek and finishes at the inner canthus. The second branch starts behind the ear, enters the ear, emerges in front of the ear at San Jiao 21, and will end up at San Jiao 23 at the lateral end of the eyebrow, connecting to the next meridian, the gallbladder. The San Jiao Meridian function as a whole is to address anything affecting the ear, the cheeks, the temple area, the neck, the throat, and of course anything along the meridian, as well as addressing issue of the San Jiao as part of the Zang Fu organ theory. San Jiao 1 is located at the lateral side or ulnar side of the ring finger at the base of the nail, point 1 soon from the base of the corner of the nail. Easy one, right? San Jiao 2 is located between the 4th and 5th finger at the web margin. San Jiao 3 is located between the 4th and 5th metacarpal, proximal to the metacarpal phalangeal joint on the dorsum of the hand. San Jiao 4 is located on the ulnar side of the extensor digitorum communis, which is on the dorsum of the wrist. San Jiao 5 is one we use a lot in clinical practice, and it is tutsun above the dorsum part of the wrist between the ulnar and the radius. San Jiao 6 is located 3 tsun above the wrist between the radius and the ulnar. San Jiao 7 is also 3 tsun above the wrist, but it is on the radial border of the ulna, so a little bit more towards the ulna area, so more lateral. San Jiao 8 is 4 tsun above the wrist on the dorsal part of the forearm between, again, the radius and the ulna. And San Jiao 9 is 7 tsun above the wrist, again, between the radius and the ulna. And remember that from the wrist to the elbow is 12 tsun, so it's a little bit more than halfway on San Jiao 9. San Jiao 1 expels external pathogen for sore throat, red eyes, or fever. It is a Jingwao point, so most Jingwao points are used for fever, but also for fainting. Also, San Jiao 1 is great to clear heat, specifically for temporal headaches, stiff tongue, and irritability. San Jiao 2 and San Jiao 3 are the yin spring and shoestring point out of the shoe transporting point. And if you haven't watched my video on the 5 shoe transporting point and how to utilize them in clinical practice with the mother-son relationship, I'll have the link for you below because it's one of my most popular videos to understand the shoe transporting point using the 5 elements. Now, those 2 points are great when it comes to tinnitus, having external pathogen invasion on the face with fever, red swollen eyes, or sore throat. San Jiao 4 is the Yuan source point of the San Jiao. So we can use it, first of all, for anything happening on the wrist or pain along the meridian as a distal point. We can also use it for the common cold and specifically for that Shao Yang syndrome, which is alternating chills and fever, because it helps expel pathogen. Also for red, swollen eyes as well. And because the meridian goes around the ear, any acute hearing loss, maybe due to an accident, this is really good to use as well as part of the protocol. The closer to the accident, the easier it is to hopefully get the hearing back. When I grew up, one of my neighbor had a trampoline and her daughter was playing on the trampoline and she fell on the side, hitting the rings or the side of the trampoline, and her head and ear hit that. She was unconscious for a while. She was in a coma for a while. When she came out, she had lost her hearing on the side where it hit the trampoline bar. So this is something that can happen with traumatic injury accident. And if we could do acupuncture as soon as possible, we may be able to restore some of the hearing. It's not always for sure, but that's the strength of acupuncture, to applying ASAP after injury. San Jiao 5, I think we use this point, I do anyway in clinical practice, a lot. First of all, it's the Luo connecting point connecting the San Jiao to the pericardium. Pericardium 6 is the opposite of that. I had a teacher who used to say, we can needle all the way through. Don't ever do that. Oh my gosh, I'm never doing that. That is crazy. Anyway, when it comes to San Jiao 5, we can use it for anything that's happening on the cheeks, on the ear, like tinnitus, on the side of the face, temple headaches, because the meridian is all around the temple area. So it makes sense, right? And because it goes through the neck, it's also really good to use San Jiao 5 when the SEM issue or tight sternocleidomastoid muscle around the neck area. San Jiao 5 is the confluent point of the Yang Wei vessel, making it a great point to combine with the di-confluent point, which is gallbladder 41. And gallbladder is a Shao Yang, San Jiao is a Shao Yang meridian. Both really go work well together. So San Jiao 5, which is the confluent point of the Yang Wei, and gallbladder 41, which is the confluent point of the Dai vessel, work really well. Remember, the Dai vessel is the vessel that goes around the hip area. It's the belt. So those two together work really well to open the hip, to relax the hip. So great for pelvic inflammatory disease, great for relaxing the hip when there is issue with the IT band or anything, hip flexors really, really tight. And I love to use those 2 points in pregnancy to relax the hips when there is so much pain at the end of pregnancy because of the weight of the baby. And for labor, to relax the whole pelvic floor in order to get a better labor outcome. Isn't that fantastic? Great combo that I love to use in clinical practice. Are you enjoying my graphics so far? Well, they are all part of my AcuPoint Made Easy book. As you can see, it is really colorful and it's so visual. People love that because it's easier to retain the information, right? Now, the digital version comes with a lot of video links to complement it. And the book, if you're like me, you're like a real book, ships all over the world. I'll have the link below this video for you if you haven't got your copy yet. San Jiao 6 is a Jing River point, but one of the best ways to use it in clinical practice is for constipation due to excess pattern. You can use this during pregnancy because you can't use belly points or large intestine 4, but San Jiao 6, super good, specifically combined with the lower Rossi point of large intestine, which is stomach 37 and stomach 36 to allow better flow and better digestion. So if the person is not pregnant, of course, you can also use stomach 25, which is the front move point of the large intestine. That is a perfect thing to do. And I actually show my patients to acupressure this point when they're at home because it works really, really well when they are pregnant and it's safe compared to large intestine 4. Now we can combine it with large intestine 4 if there is no pregnancy. Does that make sense? And if it's due to excess. Another thing that San Jiao 6 is great for is to clear excess wind heat affecting the skin, like skin rashes that are acute and specifically combined with spleen 10. That is a fantastic combo. San Jiao 7 is a Qi cleft point. And remember, Qi cleft point of any Yang meridian is going to be connected to pain, while the Yin meridian connects to blood. So the Qi cleft point of the Yang meridian, in this instance, is going to be great for pain all along the meridian. Ear pain, shoulder pain, arm, anywhere along the meridian, you gotta put San Jiao 7. It is also used as part of a protocol to prevent epileptic attack. Now, there are many points for epilepsy. This is one of them that works quite well combined with dew points like dew 9. San Jiao 8 opens the orifices. For better hearing, San Jiao 8 can help with deafness or sore throat, but really, it is a local point, really good for pain around the extensors. San Jiao 9 is a great point for pain along the meridian, specifically around the arm area, but also any pain affecting the ear, the cheeks, or the gum, like a toothache, and the temporal area of the head, like a migraine. Specifically, if you combine with long 7, which is the commander point of the head and neck, it works really well. Like there's a lot of combination we can do for headaches. This is a good pair. San Jiao 10 is 1 sun above the olecranon, and San Jiao 11 is 1 sun above San Jiao 10. San Jiao 12 is halfway between San Jiao 11 and San Jiao 13. San Jiao 13 is 3 sun below San Jiao 14 on the posterior border of the deltoid. San Jiao 14 is in the depression inferior and posterior to the acromion when the arm is abducted. And then we can see large intestine 15 as the blue dot, which is anterior, and San Jiao 14, which is posterior. Make sense? Those are really next to each other and they really work well together. San Jiao 10 is underutilized in clinical practice, maybe because of its location, but it's a fantastic Rossi point. And yes, it clears heat and relieves pain all along the meridian, but what it does is it transforms phlegm, physical phlegm, like nodules, ovarian cysts, or excess body fat. Remember, the San Jiao is in charge of the lymphatic drainage. This is a very good point to allow this to occur and to relieve all this excess water, excess phlegm that we have in the body, and all the toxins that are trapped into excess fatty cells. Now, that's a fantastic point, right? San Jiao 11 all the way to San Jiao 15 all address issues with the shoulder, the back of the arm, basically musculoskeletal issues. Now, often we want to press, see where the pain is, and pick the best point for this. What I love is like a frozen shoulder protocol, which is one of my favorite ones, which would be large intestine 15, San Jiao 14, large intestine 14, San Jiao 13, LI4, very important for the pain, large intestine 11, and Jianqian, which is an extra point that is located between large intestine 15 and the anterior axillary fold. Now, that's if the frozen shoulder is really more painful in the front. But if it's happening more in the back of the shoulder, we want to add up small intestine 9, 10, and 11, maybe even small intestine 13 to the whole protocol. And it works so well if you add up Twina and cupping, and you do this consistently, because frozen shoulder is very difficult for patients to get rid of, and it takes a long time. Acupuncture rocks when it comes to frozen shoulder. San Jiao 15 is halfway between gallbladder 21 and small intestine 13 on the superior angle of the scapula. San Jiao 16 is on the lateral side of the neck, on the posterior border of the sternocleidomastoid. It is at the level of the mandible and on the posterior border of the mastoid process. As you can see, the little green dot is between gallbladder 12 and San Jiao 17, which is below the earlobe. To give you a little bit of a reference point, I have located also the gallbladder points that are at the same area of the San Jiao, so you can see the difference. I think it helps to have a perspective. So San Jiao 17 is posterior to the earlobe between the mastoid process and the mandible angle, as you can see in the lower part. San Jiao 18 is in the junction of the middle and lower third of the curve formed by San Jiao 17 and at the top San Jiao 20. And San Jiao 19 is in the junction of the middle and upper third of the curve formed by San Jiao 17 and San Jiao 20. And as you can see, San Jiao 20 is directly above the ear apex within the hair line. San Jiao 21 is located often when the mouth is open. It's anterior to the tragus of the ear and posterior border of the condyloid process of the mandible. San Jiao 22 is anterior and above to San Jiao 21 at the level of the auricle root, where the superficial temporal artery is. So we have to be really cautious when we needle this point because of the temporal artery. And of course, San Jiao 23 is at the lateral end of the eyebrow. San Jiao 16 reduce swelling at the neck, the lymph nodes, or the cheeks. So it's really good, again, that dampness that the San Jiao is really good with. It really tries to clear that excess dampness that happens in the upper part of the neck and face. San Jiao 17 can be part of a protocol for Bell's palsy, specifically if there's pain in the ear area, which happens to a lot of my patients, by the way. It's, of course, great for tinnitus because of where it's located. All the points around the ear, including San Jiao 21, which I think would be the best one to use for tinnitus. We can use also San Jiao 17 for toothache of the lower jaw, specifically combined with large intestine 4. San Jiao 18 and 19, because they're all around the ear, again, tinnitus, temporal headaches, specifically, it's going to be really useful for that if the pain is on the side of the head, combined with gallbladder points specifically. And it can be used for stiff neck and tinnitus. Same thing for San Jiao 20. This time the toothache is more for the upper jaw, but the tinnitus is the same, and the neck pain and the side temporal headache, all the same. How would I know which one to use between San Jiao 17, 18, 19, 20? Because they really are similar in function. I would palpate with the patient and see which one is most tender. That's the one that I would needle for sure. San Jiao 21, gallbladder 2, and small intestine 19 all are located in the tragus of the ear and all do the same thing. Jaw pain, tinnitus specifically, and TMJ. Temporal mandible joint issue, right? So locked jaw, any issue happening here with the jaw or the ear, those 3 points are fantastic. Just pick one and go with it. San Jiao 22 is great for locked jaw if you combine it with stomach 7. However, we have to be really cautious because the temporal artery is right there. So I'm really cautious about this. Maybe using San Jiao 21 and stomach 7 might be a little bit easier and less dangerous. I love to use San Jiao 23 for Bell's palsy or part of a Bell's palsy protocol. And if you haven't looked at my Bell's palsy protocol video, I'll have the link below because it's very useful in clinical practice. And we use a lot of the points on the face, including San Jiao 23. And San Jiao 23 is great as part of a protocol when there's eye issue like the eye twitch or red, painful, swollen eye, or blurred vision. Fantastic. Specifically, if you combine it with gallbladder 1, stomach 2, maybe bladder 2 here, kind of really try to bring more circulation around the eye. The 23 San Jiao points have a lot of similar functions, so really try to differentiate them the best of your ability by looking at which one is strongest. For example, San Jiao 21, great for tinnitus, but you can combine it with San Jiao 3, which is also great for tinnitus as a distal and as a local point. San Jiao 10, for example, is really good to expel phlegm. That is fantastic. We also have points like San Jiao 6, great for constipation. San Jiao 5 combined with gallbladder 41 to open the hips, relax the hip girdle. Fantastic. A lot of the points of the San Jiao are very local, so it's easier to look at them from that perspective as well. A lot of points have similar function, but we always want to look at the best and differences between all of them, and this is how we utilize them in clinical practice. Wow, that was amazing. Click here for the playlist of all the other meridians, function, location, just like the San Jiao, if you haven't seen the other meridians. And no matter what, keep rocking it using TCM.